In this video, you will learn ways to help make the best medical decisions for another person when that person cannot communicate their wishes. Making medical decisions for another person can be very stressful, and research has shown that it may lead to depression and anxiety later in life. We made this video to help you feel more comfortable with the decisions you make for another person. Before making a medical decision for another person, you will need to understand what the doctors tell you about the likelihood that the person will get better, get worse, or stay the same. In order for you to make well-informed decisions, you will need information about what the patient's future looks like. This means you will need to ask the doctors specific questions like, what will the future be like? How much time may be remaining in life? And what will that time be like? You may also want to ask how these may change with and without life-prolonging treatments. If the doctors cannot currently give you a clear picture of what to expect, it may be useful to ask again in the near future. Before trying to establish what the goals are for another person, you should try to find out whether the patient has put their preferences in writing, in a document such as an advance directive or living will. If a document of this type exists, you should read it with the doctor and see if it applies to the current situation. You should also ask the medical staff whether they have a POST form. POST stands for Physician's Orders for Life-Sustaining Treatment. A POST is a set of instructions from the patient or the patient's family telling the doctors which medical procedures may or may not be used. If a POST exists, you should review it with the doctor. If there are no documents that can guide you with decisions, try to imagine what the patient would instruct you to do in this situation. Think about the kind of person he or she is and what they would decide for themselves. Try not to make decisions on what you would want for the patient, and focus on what decision they would make if they were able to. To summarize, if you are the medical decision maker for another person, first, try to get an understanding of the likelihood that the patient will get better, get worse, or stay the same. You may want to give particular consideration to what the doctors see as the best case scenario and how the patient would feel about being in that situation. If the doctors are currently uncertain about the outlook for this patient, you should ask again in the near future. Look for any POST form, advance directives, or other documents that may be helpful in determining which medical procedures should or should not be used. Once you have whatever information you can collect about the patient's wishes, you should have a discussion with the doctors and others on the medical team. This may be a very difficult decision, but you can take comfort in knowing that you have done your best to determine and communicate what the patient would be telling the doctors if they were able to. We hope that following these steps will help you make the best decisions in a difficult situation.